Hello, and welcome to today's webinar. We're introducing a new West Yorkshire Guide to Apprenticeships, created for organisations in social care and in the independent, voluntary and community sector who deliver health and care services. You have two presenters today. I'm Penny Conlin, Workforce Transformation Project Manager, currently with the West Yorkshire Integrated Care Board.
And I'm Terry Hazelgrave, System Lead for Workforce Supply, part of the System Workforce PMO team, which is underneath the Wakefield District Health and Care Partnership. We have created this guide because apprenticeships are a powerful way to grow your workforce, and many employers have told us that they would like clearer, simpler information about how they work.
Today, we'll be taking you through the contents of the guide, but this also provides an overview of apprenticeships. It includes what apprenticeships are and are not, benefits of using apprenticeships in your workforce, the common apprenticeships that are often used in health, care and community organisations. We go through what funding might be available and mainly simple steps to create an apprenticeship opportunity. This webinar is designed specifically for small social care, voluntary and community organisations to help and reassure you that apprenticeships are not complicated once you understand the basics. To start, we'd like to outline what is an apprenticeship. In England, apprenticeship is a protected term and always refers to a job with structured training. The apprentice is employed, earns a wage and learns the knowledge, skills and behaviours set out in a recognised apprenticeship standard. An apprentice is not a volunteer, they're a paid member of your workforce from day one.
Every apprenticeship is delivered in partnership with an approved training provider, which ensures quality, consistency and a nationally recognised qualification. Apprentices learn in two different ways. Firstly, we have on-the-job training. This is the learning through day-to-day work, supported by colleagues, where apprentices build skills in practice within their role. Secondly, we have off-the-job training. This refers to the planned learning during paid working hours delivered by the training provider, focused on the knowledge, skills and behaviours set out in the apprenticeship standard. Off-the-job training can be delivered in different ways, sometimes at the training provider premises, but also through online learning, planned learning time within your organisation, where apprentices may focus upon new skills away from their usual duties. Together, both of these types of learning create a structured, supported route to competence in a role and a recognised qualification.
We'd like to take you through timeframes and levels. Apprenticeships exist at different levels, from level 2 up to level 6 or 7, and each level lines up with familiar national qualifications. In our sector, the most common ones you come across are level 2. They're typically aligned to support worker roles and equivalent to GCSEs. Level 3 are for senior or lead roles and equivalent to A-levels. Level 6 is where registered professionals train and are the same degree level qualifications that someone takes at university, such as nursing degrees. Most level 2 and level 3 apprenticeships take around 12 to 18 months, depending on the standard and the candidate and their experience. Higher and degree apprenticeships take longer, between 2 and 4 years. There are level 7 apprenticeships at the moment, but the ones most relevant to this sector, mainly management, are no longer government funded from January 2026. So today we're focusing on the levels you're most likely to use at the moment, level 2, 3 and 6. The key message we want to promote today is that there are apprenticeship standards from entry roles right through to registered practice that can help you develop your workforce to deliver safe, high quality services.
So let us show you what this looks like in practice. Here is a real screenshot of an apprenticeship standard found on the national website. You can see the name at the top. This one is for the Business Administrator Apprenticeship. There is a full overview of the role and profile, showing typical tasks and responsibilities. On the website, there is further detail around what skills, knowledge and behaviours are covered in achieving the apprenticeship. The level is on the top right-hand side, and you can see this is a level 3 apprenticeship. There is also a search bar on the right-hand side at the bottom, where you will be able to find training providers who deliver each standard, and we will look at this in more detail later.
Apprenticeships are open to any employees aged 16 and over, whether they are existing staff or if they're starting with you as an apprentice from the beginning. There are some requirements to be eligible for an apprenticeship in England, which includes that the apprentice is not in full-time education, can meet any job-specific entry requirements, lives in England. They also need to have the right to work in the UK and meet residency requirements for apprenticeship funding. Training providers will be able to guide you if in doubt and will be able to assess your candidate's eligibility.
We think it's useful to be aware of the many potential benefits of using apprenticeships in your workforce for both employers and organisations as a whole. Firstly, they help to develop your own workforce when recruitment could be difficult. Apprenticeships support social value, local employment and inclusion, and can be an attractive way for local people who haven't worked in the sector before to join your organisation. They help build skills, confidence and competence of both new recruits and also existing staff. As apprenticeships are available at different levels, they can offer clear progression routes for staff to advance through a profession. This can make the work look more attractive to people when recruiting and also helps retain current staff. For example, someone coming into the sector as a health and care support worker apprentice can eventually go on to achieve a level 5 leader in adult care or registered manager qualification through an apprenticeship. Staff feel valued when they see investment in their development, which can also support their health and well-being. It can also be a cost-effective way for your staff to learn. Compared to other training routes, there is government funding and ways to cover the training costs in full, which we'll describe in more detail further on. Alongside these benefits, there are also financial incentives for employers. From October 2026, non-levy paying employers will be able to access a £2,000 incentive when they hire a young person on an apprenticeship, providing that certain eligibility criteria are met. Depending on the apprentice's circumstances, this can increase, in some cases adding up to £8,000 in total when all applicable incentives are combined. For further detail, this can be found on the main government apprenticeship website, but it's useful to be aware that there are these incentives out there designed to make it even easier for small organisations to bring young people into the workforce. In this guide, we have also provided examples from local health and care partners to demonstrate how apprenticeship roles have been used within their organisations. These case studies highlight how apprenticeships can support the development of new roles and required skills, as well as how they can be used to support individuals progressing into team leader or leadership positions.
In the guide, you'll find a section outlining the apprenticeship standards commonly used across social care and VCSE support services. There are many apprenticeships that can benefit the sector, from those focused on direct care, but also facilities, catering, administration and finance, the full roles and jobs any organisation needs to function. Whichever role you're considering for your organisation, you can use the Skills England apprenticeship search to find the most relevant standard that matches the skills and knowledge needed in your organisation. You'll find the link here on the page and in the guide. As we go through the next few slides, will highlight examples of standards available to you that you might want to consider for your staffing needs.
Here are some of the apprenticeships that are relevant to roles involved in direct care and support. The first is a new Health and Care Foundation apprenticeship at Level 2. This could be a choice for those individuals just starting out in the sector. It provides a broad introduction to health and care work and is suitable for new health and care support assistants working across care homes, community teams, GP practices, or home care-based teams. The adult care worker or healthcare support worker level 2 is ideally suited to frontline staff who may work in residential or nursing homes, domiciliary care, day centres, or within a person's own home. The lead adult care worker or senior healthcare support worker at level 3 is an apprenticeship for those delivering frontline care, but also where their work involves frontline leadership, supervision, or guidance of others. Or they may work more autonomously and need this level of skill compared to level 2. The leader in adult care or registered manager at level 5 is appropriate for a leader of a care team managing community or residential based services. Individuals will typically be registered manager of a service or a unit. There are also apprenticeship standards that are increasingly being used in the voluntary community and social enterprise sector. For example, the youth support worker, community health and wellbeing worker, and the peer support worker, all at level 3. These apprenticeships train people to support individuals and communities by helping people build confidence, improve well-being, and make positive changes to their lives. They may also be considered as a great way to bring in volunteers with lived experience through to paid employment, building on all the experience gained through volunteering.
We'd now like to go through the main steps needed to set up an apprenticeship. There's further detailed information in the accompanying guide. Step 1 is to identify the workforce need. Is it for a care role, community support, or administration role, for example? You then look for an apprenticeship standard that matches this workforce need, the role you want to access training and a qualification for. As previously mentioned, the Skills England website allows you to search all the apprenticeship standards. And here's a screenshot of showing what it looks like and how to use it. You can use this tool to find apprenticeship standards that match your need by several ways. You can type in a keyword, which could be a skill or a role. You can see where we have put care in the box. Another option, you can tick the appropriate route that relates to your sector or industry. And you can see where we've put care services. Then all the apprenticeships that relate to your search will be shown in that main column, listed. It will provide detailed information within each box when you select it that will include what the apprenticeship covers, the level, the duration, the cost of training, and other information.
Step 2 is to find a training provider and identify funding. As shown earlier, you can use the National Find an Apprenticeship Service page to find an apprenticeship standard. It also allows you to search for a training provider to see who delivers that standard. This search will take you to another web page with training providers shown. You can filter to intended learner work location and also learner distance to travel. All providers will be shown within your search parameters. The results can then be filtered. In this example on the screen, you can see we have used the filter 2 mile distance according to a filter of West Yorkshire as a location. The website will then give further information about each training provider, including things like course achievement rates, their Ofsted rating, and previous user reviews. It's good practice to contact several providers to discuss your requirements before deciding who to work with. You can also contact any local college in your area to check their offer, as they will have specific apprenticeship teams who work with employers such as yourselves.
We've covered finding a training provider, and we'll go through the second part, which is identifying funding. We've already explained that you, as the employer, pay the apprentice's wage, but it's really important to stress that there is usually funding available to cover all the training fees that the training provider requires to deliver the apprenticeship. Under apprenticeship funding rules, the government will pay 95% of training costs for most apprentices, leaving 5% for you, the employer. It depends on the cost of the apprenticeship, but this could be several £100s per apprentice. In practice, most small organisations don't need to pay anything for apprenticeship training, as this can be covered by something called an apprenticeship levy transfer. This is where larger employers pay into a national growth and skills levy, and if they don't use all of their levy funds on their own staff training, they can transfer some to other organisations. You can inform your training provider that you'd like to use the levy transfer, and this will cover 100% of their costs, so you don't need to contribute. There are three main routes available in West Yorkshire where you can be matched to an employer who will fund the training element of your apprenticeship. Details of all of these are in the guides. The first is the NHS England run Levy Transfer Matching Service for the region of North East and Yorkshire. They have large organisations from across the country and from all different sectors, as well as local NHS trusts who would like to donate their spare levy to other health and care organisations. In the guide, you'll find their contact details. And once you know your apprenticeship and your apprentice, you can apply to them for a match. This is one of the main one for health and care organisations, and other options, such as the West Yorkshire Combined Authority Levy Transfer Scheme or the National Levy Transfer Directory, are described in the guide in more detail.
You're now ready for step 3, which is to recruit your apprentice. Whether this is an existing member of staff or you're wanting to find a new employee. If you're recruiting someone new, the apprenticeship role can be advertised via your usual channels. However, there is also the option to advertise on the National Apprenticeship website once you have created an apprenticeship service account. This will widen your exposure of the apprenticeship role to people specifically looking for apprenticeships, and it's also free to use. The training provider will check that the candidate meets the requirements to take on the apprenticeship training. This takes us then to the next step. Step 4 is about putting agreements in place. Once you've chosen or found your apprentice and your training provider, there are 2 pieces of paperwork you'll need to have in place. First is the apprenticeship agreement. This is the apprentice's contract of employment. It sets out their terms and conditions and must last long enough to cover the full apprenticeship, including the assessment at the end of the training. Second is the training plan. This is signed by you, the apprentice, and the training provider. It sets out what training will be delivered, when it will happen, and what each party is responsible for. It also explains how questions, issues, or complaints will be handled, and guides support throughout the apprenticeship. If you need them, the Government Apprenticeship website includes example training plan templates, and your training provider will usually guide you through completing the plan for your apprentice. So this brings us to the end of the apprenticeship process. From choosing a role, to finding a provider, to arranging funding, to putting agreements in place, and supporting your apprentice throughout their programme.
Today has been about giving you an introduction, a clear overview of how apprenticeships work and what the process looks like in practice. There is plenty of support available locally and nationally if you want more information or advice. Your local care association may be able to offer guidance for social care providers, and the guide includes all the local West Yorkshire contacts. Most local councils also have training or skills teams who can help navigate apprenticeships, and these can be found on your local authority website under usually employment and skills. Alongside that, the national apprenticeship resource we've mentioned and the links to this in the guide provide the most up-to-date information, templates and step-by-step support. There's a clear employer support site with a helpline and email address to answer specific questions once you're setting up your apprenticeship. If you have questions as you start looking at specific roles or standards, these specialist resources can help you and keep their information updated regularly. That brings us to the end of the quick guide to apprenticeships. We would recommend you read the guide we've produced, and the link is on the next slide. This brings all the national resources together in one place. Thank you for joining us today. We hope the guide and this session give you the confidence to start using apprenticeships to grow your workforce and support the community.